it's kind of dawning on us how long we might be in here for. Hi, I'm Alex and I've been diagnosed with coronavirus. Okay, now I'll take you on a quick tour of the apartment. This is where I've been working, which is...
Alex Lewis is 24. She and her boyfriend Ed are now in isolation. Both have coronavirus.
Show you where Ed's setup is in the bedroom, which is great. He's just working away. The first shock of being diagnosed was pretty intense. Lots of, feelings, sad and confused and worried for the amount of people that we'd seen. That kind of thing was definitely playing on our mind.
The couple had felt unwell for several days.
I had a bit of a cough. It was a very mild, dry cough. And then I woke up the next morning with a full-blown flu. I had a headache, fever, chills, body ache, exhaustion, that kind of thing.
But being tested wasn't a simple matter. The first attempt failed.
We both were having similar symptoms and we were turned away as we had not been in contact with anyone with coronavirus or had been overseas.
So they went to work. 3 days later, someone they know tested positive. Then they both did too.
It came back positive on the Friday. Ed's did not come through until that following Sunday, so that was 3 days after being tested.
We only have a certain quantity of the test, that's just it. So we need to look at the high-risk groups. And when we've done that, that's been most effective in actually detecting whether someone has the disease or not.
Professor Bruce Thompson says testing people who've been overseas or in contact with someone with the virus remains the focus.
The tests have been turned around in a few days. They do take a little while to do. Clearly we have a big backlog because we're testing a lot of people at the moment, so that's a little bit of patience required. However, the tests are very accurate. We're basically looking at the internal sort of mechanisms of the actual virus, the actual structure of it.
And you haven't travelled overseas or been in contact with anyone with a confirmed case, no?
The last few days, the concern has really gone up. It's all about, okay, what do I actually need to do? Some people are quite panicked.
All right, we'll see you at 10:45.
Okay, how's the workflow going?
Busy, Marek.
Busy?
Phones are going crazy, everyone's in panic mode.
Have you sent anyone for testing this morning?
No.
Okay.
Few in isolation though, and all masked up, so.
Okay.
At the Med Plaza medical practice in Sydney's inner west, the workload has increased dramatically as they introduce measures to deal safely with coronavirus.
We are asking patients to call us first before they come into the surgery, and if they have cold or flu symptoms or a fever, we then try to triage them, and the receptionists are doing that. We try to find out if they satisfy the criteria for testing, and we then send them directly for testing. The patients that are coming in that are sick, coughing, we distribute a mask here at reception, and we ask them then to go into this converted consultation room, which we're using as, well, I guess, an isolation room. Testing has been a real concern for us. Initially, we were setting up to test here in general practice, and we had worked out a workflow to do that, but we lack personal protective equipment. So unfortunately, we've received a few boxes of masks, but we don't really have disposable goggles, we don't have the gowns. So according to the current guidelines, we can't test if we don't have that equipment. So we're relying on pathology and the hospital system to test patients.
It's been pretty busy, yeah.
Dr. Steiner is worried that some patients with the virus are being missed.
At the moment, we're only catching cases that satisfy a very narrow set of guidelines, and we know that already a quarter of patients that have tested positive had no contact and did not satisfy that initial set of criteria. So we know that COVID-19 is spreading in the community. We need to sort of test to capture as many as possible.
I'll show you the contents of the fridge. So there's plenty of food in here.
It's now day 6 of isolation for Alex and Ed, and they're feeling the need to move.
I haven't done any exercise in probably 3 weeks now since I first started getting symptoms, and so I'm feeling a little bit flat and like I haven't moved in a really long time. So I think today we're both going to put a YouTube video on about exercising inside, maybe a yoga or Pilates.
It's not clear how the couple picked up the infection, but they're counting down the days until they test negative to coronavirus.
As soon as we feel better, we can go get tested. If that test comes back negative, we then wait a couple of days before our next test, and if that test becomes negative too, we can walk free.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.